Troubleshooting Series, Aligner's Initial Delivery Visit. This is the first video in a series of modules on troubleshooting. We will cover the different clinical scenarios you may encounter during clear aligners treatment from the initial visit up until the retention phase. We hope to provide some helpful clinical tips and tricks to approach and manage various treatment scenarios. In this video, we will start with the troubleshooting and problem solving you may have to do during the initial aligners delivery visit. Attachments template and aligner fit. The initial visit for aligners delivery is considered one of the most important visits for the patient and will probably be the longest. This is when you will introduce aligner wear to your patients, provide the necessary instructions, and in most cases, place attachments and perform IPR as and when the case requires. Start by opening the patient's aligners box and check the items inside. The box should include an attachments template marked as T1, the aligner steps, the patient use and care manual, an aligners box, an aligners removal tool, and chewies. The next step is to check the fit of the attachments template, as most cases require attachments to be placed before wearing aligner number 1. The attachment template will be marked as T1. A good fitting template should cover all the teeth and fit well up until the last tooth in the arch. As seen here, notice that the template is fitting tightly, with no gaps between the incisal edges of the teeth and the template. In this scenario, we can go ahead and start our attachment bonding procedure. It is also a good practice to ensure that aligner number 1 fits properly before bonding the attachments. This will be of use later if problems in the aligner fit are noticed, as we will show later in this video. One scenario that you could encounter is an attachment template that does not fit properly. The template could be poorly fitting on all teeth or on multiple areas of the arch, as shown here. This could be a result of poor quality impressions or, less likely, a manufacturing error. So what can we do in this case? First of all, never attempt to place the attachments using this template, as it will result in poorly fitted aligners due to the improperly placed attachments. But go ahead and try aligner number 1 in the patient's mouth. If the fitting is good, then you can use this as a template instead. Sometimes, using the aligner as a template may be challenging, as it's made of a more rigid material than the template material. In such a case, you can request a template replacement after making sure there is no impression quality defect. In cases where both the template and the aligner number 1 do not fit properly, it is most likely because of an impression quality issue. New records should be obtained then and an adjustment requested. One tip that could be useful is cutting the template in half and checking if each part on its own fits the teeth as desired. In this scenario, we can still use the existing template to place attachments. Another scenario is when a template fits properly on all areas of the arch except 1 or 2 posterior teeth, as shown here. In this case, we can try to push it over the teeth and proceed with its use for attachment placement. You should take the help of the dental assistant to keep the attachment template firmly in place while curing the composite. Trying in aligner number 1 is an essential step in cases of poorly fitting templates to rule out any impression quality defects which may be causing the inaccurate fit of the aligners and templates. During the attachment bonding procedures, it is possible to face issues of attachment debonding or even partial fracture. This could be due to poor bonding technique or lack of proper moisture control. If the attachment completely detaches during template removal, you can simply remove the composite within the pocket and repeat the procedure using the same template. Otherwise, if one attachment debonds during the treatment, you can simply reattach it using the current aligner step as a template after ensuring the fit is ideal. After finishing the attachment bonding procedure, move on to try aligner number 1 in the patient's mouth. At this point, the fit should be ideal. If you notice any poor fitting areas after the attachment's placement, go back and visualize the attachments and ensure no excess composite is affecting the aligner seating. After placing the first aligner, a few points need to be checked, including the presence of rough edges or pressure areas. Although Eon aligners go through multiple polishing stages and are hand-finished to ensure smooth contours with better precision, it is not uncommon to encounter one aligner with a slightly rough edge, as shown here. It is important to learn how to deal with such encounters to eliminate any discomfort the patient goes through without any delays. A patient can notice or feel an aligner rough edge right from step 1, or at any time during the treatment. If you notice this during aligner delivery, you can address this by using a finishing burr to carefully smoothen the edges of that area. Make sure not to remove or cut a large area of the aligner, as this will affect the fit. Notice how the aligner edges are polished here. If the patient has noticed rough edges a few hours after wearing the aligner at home, or while he is away from the clinic, you can instruct them to use a nail file to smoothen that area. Pressure areas are other issues you may possibly encounter, mostly in the posterior areas of the jaw. This could be due to inadequate capturing of the area in the impression or scan, specifically in the partially erupted third molars region. Check for any blanching or extended parts of the aligners. If you notice this during the aligner try-in, there is no need to jump in and request a replacement or take another scan. You can simply use sharp scissors or a blade to cut the part impinging on the gingiva. Remember, this should be done carefully to avoid losing retention in that area. Remember that the way you tackle or troubleshoot different clinical scenarios depends on your clinical judgment, which will develop over time with practice, experience, and knowledge. Thank you for watching.